Good morning, everyone. My name's Andrew Sixsmith, and I'm Director of the Gerontology Research Centre here at Simon Fraser University. I'm also the Conference Chair. It's my great pleasure and privilege to welcome you all to the 20th John K. Friesen Conference on the topic of growing old in a changing climate. And I would also like to welcome you to this beautiful city of Vancouver, for those of you who are visiting it for the first time. Just some background on the Friesen Conference series. John Friesen was a long-time supporter of the Gerontology Research Centre. And when Gloria Gutman, who was founding director of the GRC, the Gerontology Research Centre some 25 years ago, when she originally started, she became aware of John's interest in the field of aging, and I believe John actually had, Gloria's told me, a conference on aging back in the 1950s, I believe. Okay, so John was really a visionary and someone who was aware of aging as an issue for policy and practice many years before gerontology became really an academic discipline. And John was kind enough to provide an endowment which has allowed us to hold the conference ever since. And our particular aim over the years has been to address important topics within gerontology that have important implications for policy and practice in relation to seniors. John died last year, but I'm sure he would have been really happy with the current conference, which brings together, really for the first time, the key issues of population aging and climate change. Everyone is aware of unprecedented population aging. In Canada, for example, we currently have a population of seniors aged over 65 of around about 14–15%. By 2031, this will have risen to around about 25%. The challenge of an aging population requires innovative approaches to meet the needs of increasing numbers of older people within society. In particular, there is a need to move from a health and social agenda that emphasizes dependency to one that promotes active aging and creates supportive environments to enable healthy aging in the settings where older people live. But we also need to address this issue in the context of climate change. In recent years, we have been witnessing perhaps some of the effects of climate change on seniors. For example, the many deaths that occurred during recent heat waves in Europe and Russia. We also need to consider that many older people are particularly vulnerable during events that we've been witnessing in the media recently, such as Hurricane Katrina or the hurricane in Haiti. Over the next 2 days, experts in gerontology and climate change from around the world and from here in Canada and British Columbia will be sharing their knowledge and experience through many exciting keynote lectures, plenary panels, symposia, and posters. Topics we will be covering will be wide-ranging and include the health impacts of climate change on seniors, the implications for housing, care, and social support for older people, risk assessment, health and social services preparedness, the adaptation processes of older people in relation to environmental change, and the potential role of technology. I hope everyone will find the event exciting and intellectually stimulating, and I do hope that you also have an opportunity to come to the various social events that we have planned and certainly enjoy the city while you are here. So welcome. And thank you all for coming here. Okay, it's my great pleasure to chair the opening ceremony here. And first of all, I'd like to welcome to introduce Laurie Anderson, who is the Executive Director of Administration here at the Vancouver campus.
Thank you very much, Andrew. Thank you, Andrew. Good morning, everyone, and welcome to Vancouver. On behalf of the university and our president and vice chancellor, Professor Andrew Petter, it's my great honor to welcome you all here to our Vancouver campus and to this conference, and to Dr. McDermott, the undersecretary, to be with us as well. We're here in the university here downtown. As you probably know, we have our main campus. You may not know if this is just coming into the city. Simon Fraser University's main campus is in the city of Burnaby, on top of a mountain, about 20 kilometers from here. And we also have a campus in Surrey, a growing municipality on the outskirts of Vancouver. And down here in Vancouver, of course, we have our own downtown location, which we're very proud of. The building you're in now, the Seago Graduate School of Business, is one of 2 heritage sites that have been repurposed to be part of our downtown campus. I do hope you have an opportunity to come to the 3 other locations we have, all within very close walking distance to this building, as part of your time in between sessions or in the evening when you have the opportunity. Please take a look at our downtown campus. We're extremely proud of Simon Fraser University, Vancouver, in part because what we've been able to do to energize and animate the intellectual scene in downtown Vancouver, and in addition for doing pioneering work in a number of different faculties. The work that Dr. Gutman started here in gerontology back in the 80s, at a time before studying gerontology was so prevalent as it is today, as Andrew was alluding to. And also the fact that we do a lot of interdisciplinary study, which has been part of the fabric of Simon Fraser University since it opened initially in 1965. Your 2 topics today are timely ones to study. We're so pleased you've taken the time and the opportunity to be here. There's a lot of exciting sessions that are going on here, and I hope you have the chance to meet, connect, and mingle with your colleagues from all around the world. So again, on behalf of Simon Fraser University, it is indeed my pleasure to welcome all of you to Vancouver and to the conference. Thank you very much.
Okay, could I ask Margaret McDermott, who is Parliamentary Secretary for Seniors to the Ministry of Health here in British Columbia, to give us a message from the British Columbia Ministry of Health.
Good morning. I want to say I'm from the government. I'm here to help you. And I'm very pleased to be here this morning, first to bring you greetings from Premier Christy Clark and Minister of Health Michael DeYoung. Very fascinating topics that you have today, and I understand that a conference like this, 2 trends, what we know about the demographics of the population and what we know about climate change, and I understand that these 2 have never really been juxtaposed in this way. At a government level, the Secretariat for Climate Change and the Secretariat for Seniors have actually begun to meet now and realize what common ground they have. So I'm certainly pleased to welcome you to the conference. I've been a politician for a couple of years, and my mother is my great critic, the great government critic. She's 79 years old, and I mentioned this conference to her, and her immediate response was, "Why are seniors being blamed for global warming?" But when I explained to her some of the things that would be talked about, she was fascinated. And I think many people like her will really be eagerly looking to see what are the learnings that come from this, what are the policies, the suggestions going forward. And I know she's going to be keenly interested, and others who hear about this will be as well. And we certainly know, I guess there's still some controversy, some discussion back and forth about climate change. People don't accept all of the science around it. But I've never heard anyone ask questions or question the demographics. We know in British Columbia, in fact, politicians have been talking about this thing called the silver tsunami. And as my hair gets more and more silver, I actually say I find this term rather objectionable. You know, a tsunami is not a positive thing. It never has been. But we should really be, I think, delighted in British Columbia that our population is aging, that people are living longer. And when we think about our older British Columbians, the majority of them are living well. They are doing thousands of hours of volunteer work in the province. They're working. Many of them are entrepreneurs, have their own businesses. They are inspiring their grandchildren, and in some cases providing care for their grandchildren. They're just doing all kinds of things. But we also know that some of them are frail and vulnerable, and particularly when we think about some of the issues that come forward with climate change and with disasters, they're particularly vulnerable. So rather than thinking about this as a challenge, just rather that it's a reality that these demographic changes are happening, and we do need to be thinking, and I know that you all will be doing that. Our government, I am actually very proud of some of the things that we've done, both in the area of climate change, but also to do with seniors. And yesterday we had a very positive announcement from Premier Clark and Minister DeYoung about the Healthy Families BC strategy, which was launched yesterday. And this is directed toward all British Columbians and certainly our older citizens as well. Investment and policy that will help all of us to be healthier in various different ways, including an investment to assist family physicians to work with each of us so that we can be better owner-operators of our bodies. We know these simple things about regular exercise and not smoking, moderate alcohol intake, eating well, maintaining a healthy weight, but we really need to get those messages out because not everybody's embracing them. So a very positive Healthy Families BC. And we're committed to doing the best we can, in particular for our older citizens. And that's going to need not only the efforts of the provincial government, but all levels of government and really not-for-profits, corporations, and individual citizens. So we really need to work together. I certainly want to take just a moment to thank SFU's Gerontology Research Centre for hosting this conference and for bringing people, experts, people who are interested and passionate about these areas together. And we're really looking forward to hearing what comes from this conference and then working to plan with you going forward as to how policy should be shaped and how we can do the best to work with what we've got, which is an aging population, demographic changes, and climate change, all of which actually do fit together in some ways. So the work of the Gerontology Research Centre is much appreciated by us in government. They're continuing to help us to understand how we can improve the quality of life for our older citizens. So thank you very much. I hope you have a wonderful time here in Vancouver. And I guess I'd be remiss if I didn't conclude by saying, go Canucks, go. Thank you.